Assalamualaikum and very good afternoon. I'm Azlida Abdul Kadir, oncology nurse from HUSM, going to talk about care of chemoport, more to assessing and flushing the venous access port or VAP. Before we begin the procedure, we have to explain the procedure to patient and obtain the consent from the patient. So now I would like to introduce various type of chemoport with various type of catheter. This is multiple type of chemoport. This is for adult, and this one also for adult, but different brand, and the small one for pediatric. Under types of catheter, we have open and closed-ended catheter known as Grosjean catheter. This is open-ended catheter. To prevent any blockage of this catheter, we should maintain positive pressure during flushing to avoid backflow of the blood into the catheter. For Grosjean catheter, there is no opening at the distal part, but it has a valve to allow catheter to operate as a closed system. Valve will be open if there is positive pressure from the diaphragm of the chemoport. This is important to prevent blood clot. Now I am introduce the multiple size and type of needle used for chemoport. The needle we call non-coring needle. This is a non-right angle needle and this straight needle. Normally we use right angle needle because it is more stable and comfortable to any continuous infusion to the patient. This is special right angle needle with wing, which is more stable and it's connected to Y extension tubing, and it also has inline clamp. This special design more comfortable and safety to patient and nurses. After explanation and obtain consent from patient, we should inspect and palpate the site of chemoport. Determine the types of VAP implanted, either single or dual port, and make sure the incision site is clean and free from any sign of infection and any complaint of pain from the patient. This procedure is dry procedure, and as a nurse we should abide the principle of aseptic technique. To ensure the sterility, we should perform medical and surgical hand washing before the procedure. Now I am going to introduce the equipment required for procedure assessing and flushing of venous access port. We need antiseptic solution, povidone iodine, spirit 70%, keyhole dressing, and dressing towel. Brine forceps, tooth and non-tooth dissecting forceps, and the most important thing, heparin saline with 1000 unit in 10 ml of normal saline. This is a right angle non-coring needle with wing, clamp, and Y injection site. Now I am going to show you the technique of priming non-coring needle. So affix the 10 cc syringe into the injection site of the tubing system and prime the tubing. Make sure there is no bubble in the tubing. Leave the syringe attached to the tubing system. Now I want to demonstrate full procedure of assessing and flushing chemoport. Hope you can follow this procedure. Now we're going to connect the IV drip to the chemoport that we just inserted just now. As usual, we must maintain our aseptic technique. We must clean again with spirit swab at the connection. Then disconnect the syringe and fix to IV drip line. Open the clamp and run the IV drip. Cover the connection part with the gauze to prevent just in case any leaking. Then we secure with the plaster. Make sure that the patient is comfortable and safe. And finally, remove glove, discard used equipment and wash your hand. And lastly, document the outcome and finding of the procedure in the nursing report.